Good morning, guys. Epistaxis is a very simple topic. Here two important things you must remember, two important areas. One is Litter's area and another one is Woodroff's plexus. What is a basic blood supply to the nose? Let's see now. Now you can see there are four major arteries here. One anterior ethmoidal, two posterior ethmoidal, three superior labial, 4 spinopalatine and greater palatine arteries, and fifth one is ascending pharyngeal artery, which gives another branch. Here you must remember is what you should remember is what arteries make what plexus. First is Litter's area. It's a very common area, most common site for epistaxis. It is formed by 3 arteries, not by posterior ethmoidal. Very important bit, asked in many exams. Anterior ethmoidal, superior labial and spinopalatine forms Litter's area. Litter's area is anterior. Next, come to the posterior surface. Posterior, there is a posterior to the inferior turbinate, there is one more plexus, that is Woodroff's plexus. It is formed by spinopalatine and ascending pharyngeal artery. Posterior ethmoidal does not form Woodroff's plexus also. Posterior ethmoidal is like widow artery, like it doesn't form any of the plexus. It is there supplying the nasal septum. So now in epistaxis, let's move to the next part. What are the Litter's area? What is the Woodroff's plexus? What are the treatment we must give? You see here, spinopalatine forms both Woodroff plexus and Litter's area. That means it will supply whole nasal septum. It is a very big artery. That's why it is called as artery of epistaxis. Spinopalatine artery is the artery of epistaxis. Why it is called as artery of epistaxis, I will tell you. Now let's come to Litter's area. Litter's area is an arterial plexus. Arteries form this area, but compared to Woodroff's plexus, the venous plexus, they are the venous plexus. Veins form this area. Litter's area is an arterial plexus. Woodroff's plexus is a venous plexus. Litter's area is called as the most common site of epistaxis. Woodroff's plexus, it is the most common site of most common cause of idiopathic epistaxis. Usually epistaxis is due to the injury. Nose picking is the most common cause for the epistaxis. But if it occurs idiopathically, then Woodroff's plexus is the most common site to occur. Now let's jump to treatment. The treatment is, first, for the anterior epistaxis, we just do Trotter's method. Trotter's method means picking the nose like this. Picking the nose with with the thumb and index finger, and within 3 to 5 minutes the bleeding will be stopped. If not, we'll go for cautery. Either it is a chemical cautery or the electrical cautery. It's a very simple thing. Anterior epistaxis, try Trotter's method. If not, directly go to cautery. But for the posterior epistaxis, you must be very cautious. The thing is, first you should do one side packing. If the epistaxis is from the one side or other side, do it one side packing. If not, bilateral packing you do, anteriorly and posteriorly. If the packing also didn't help you, then try with Foley's tube and local anesthesia. Send the Foley's tube inside and inflate it, and it's a type of packing along with the local anesthetic. It will help you to stop the bleeding. Then also not responding, then you have to go for TESPAL. TESPAL means transendoscopic spinopalatine artery ligation. Why spinopalatine artery? Because it is an artery of epistaxis. It is called as artery of epistaxis, the most important artery in the epistaxis. So spinopalatine is ligated. Even after TESPAL doesn't controlled, you go for axonal carotid artery ligation. Never do ICA ligation, because ICA is a very important artery to the brain. So ECA ligation you have to do. If not, epistaxis is controlled. So it's a very important area. What is the blood supply to the nasal septum? So most commonly asked in many times in many exams. And what is the artery which does not take part in the Litter's area? It's one of the most repeated question. And what is the treatment for anterior and posterior epistaxis? Hope you like it. This is a revision video. Keep revising the things. Exam is near. Matt Tipster @MattTipster. Follow us. Like, share and subscribe our YouTube channel. Thank you.